Thank you, Madam Deputy Speaker. And I must confess, I'm slightly surprised that the Lib Dems have brought an Opposition Day debate about hospitals and stated in that way, because I think the last thing we need in this country is a load of promises we cannot keep. Yeah. And one of the things that I'm proud of, being on this side of the bench, is that we have provided sustainable and affordable plans in the new hospital programme. But also, I'd also like to point out, I've been on the doorstep quite a lot in the last few weeks for the county council elections, and the number one priority that comes up is GP access. And we have provided 1,500 new GP posts in this country. The waiting lists have been going down for the last 5 months. And also dentistry, emergency dentistry is also very commonly brought up on the doorstep. We have provided 700,000 new appointments. There's many other things in the NHS which are crumbling, actually. And I see the crumbling of the hospital buildings as a metaphor for what's happened to the NHS over the last 14 years. Yes,
I thank my honourable friend for giving way, and he's obviously talking about the really important work done by Lord Darzi and the findings around crumbling hospitals in England. And I thought he'd be interested to hear that recent figures show that the high-risk repairs needed to Scottish hospitals, the bill for this stands at £64 million of repairs that have not been carried out under the SNP. And this includes 2 high-risk repairs that are badly needed at Cameron Hospital in Fife, used by some of my constituents, which have been outstanding since 2016. And I wonder if he agrees with me that the Scottish Government should be using some of the record funding provided to them by this Labour Government to fix our hospitals in Scotland.
I'd like to thank my right honourable member, and of course, I think it's absolutely essential that we maintain the hospitals so they're actually safe to treat patients. And I agree with you about spending this money. And in fact, the backlog bill, as we know, for repairs in the NHS runs at £13.8 billion. I work as a GP still in a GP practice, and I note that Lord Darzi estimates that £37 billion have been not spent on the NHS since 2010. And it feels like that when you work in the NHS. There is a massive building project ahead of us. Can I also say that the previous Labour government built 100 new hospitals, and one of them, one of them that they built was the Vale Hospital in Dursley, which we started, and I had a hand in 2008. And these community hospitals, as many honourable friends have said, are really crucial to how the NHS works. And so we must invest in our community hospitals, we must use them properly, and the Vale Hospital provides excellent MIU services, a specialist stroke service, and inpatient beds for the community. So we must invest in our community hospitals going forward. However, as we've heard, there were meant to be 40 new hospitals in the last few years, and it turned out that none of them got built and they weren't even funded. So, moving on, actually though, I would also say that we need to get out of hospitals. We need to get our care back in the community. What I would also say is an honourable member for Oxford West and Abingdon was saying about GP premises. 20% of GP premises were built before the inception of the NHS. And I actually inherited one of these in Dursley, and we have built a purpose-built surgery at May Lane 20 years ago, which we're still enjoying the benefits of, and that provides patients with excellent services. So we must invest, and I was glad to see £100 million being invested by this government in GP surgeries. But also we've got to pull care out of the hospital into the community, and I was so pleased to see that 80 million has been put into GP advice and guidance, which allows consultants to give GPs advice so they can care for patients in the community. And I'm also really, really delighted with this push for neighbourhood health centres. Neighbourhood health centres must be the way back. We must bring back the family doctor. That's what really makes patients better. It's that continuity of care that's so important. And we also have to integrate health and social care in the community so we can pull patients out of hospital. And that also applies to emergency care. Far too many people are having to go to big district general hospitals, to overwhelmed A&E places where actually at the moment only 20% of acute admissions go through a GP, and they are the best people to avoid admission. So we have to change all of this. So what I would say, ending, Madam Deputy Speaker, our NHS staff and patients deserve better than we have. They deserve facilities that reflect the excellence of care provided within them, and the Labour government is committed to rebuilding not just our hospitals, but our trust and our integrity of our public service. Thank you.